एंड लाइफ इज़ ब्यूटीफुल व्हेन योर हेल्थ इज़ ब्यूटीफुल। और इसी के लिए हम हमेशा आपके लिए ऐसे डॉक्टर्स लेके आते हैं जो स्पेशलिस्ट हैं और जो आपको बताते हैं कि आपके जितने भी बॉडी पार्ट्स हैं उसको कैसे सही तरीके से रखें। एंड वन ऑफ द मोस्ट इंपॉर्टेंट थिंग्स इन आवर बॉडी इज़ आर लंग्स। वी डेफिनेटली डोंट डू मच फॉर देम। एंड टू talk about that and all the conditions associated, we have with us Dr. Ahmed Youssef. He's a specialist pulmonology at Canadian Specialist Hospital. Hi, doctor. Welcome to Live Talk on Talk 100.3. How are you doing?
I'm fine. You are welcome.
So, doctor, you said that bronchial asthma, right? That's the
Yes, bronchial asthma. Yes.
yes. So that is something that is bothering you right now. So, what exactly is it, and how common is it in the UAE?
Bronchial asthma is a common disease in the United Arab Emirates. Most of cases are genetic or hereditary. Bronchial asthma is in most of cases a hereditary disease, and the symptoms of the disease are that patient is complaining frequent cough, chest tightness, and breathing difficulty. And some patients hear the voice of wheezes coming from their chest, and the disease is
Okay.
common.
Okay. And when it comes to lungs, like I said, it's one of the most important parts of our body, but it's often neglected. There is never a time that we actually, take care of our lungs. We never ask the doctors what diet to have, what to do. So if you can tell us some basic tips of making sure that our lungs remain strong.
I advise all patients of bronchial asthma to avoid exposure to dust.
Okay.
Okay, and the home has to be clean. Patients who are asthmatic have to avoid growing pet animals at their home because the hair of these pet animals can
Okay.
induce asthma manifestations when they inhale the hair of their animals.
Okay.
Okay, strong odors, perfumes, and before also can annoy patients who are having bronchial asthma because they develop allergic reaction which leads to narrowing of the airway and chest tightness.
Right, right. But apart from bronchial asthma, what are the conditions that you commonly see your patients with?
You mean other diseases other
Yeah,
than bronchial asthma?
yeah, which are related to
The co-
lungs, breathing.
the commonest is the respiratory tract infection.
Okay,
Okay, I advise all people to follow the hand and the hand hygiene.
okay,
Why? Because most of respiratory tract infection is transmitted through hand. Because when you touch any surface having infection, anyone sneezed or coughed on a surface, when you touch this surface with your hands, then you touch by your hand, your nose or your mouth, you infect yourself. So I advise everybody to follow the high hand hygiene.
okay, okay. And when it comes to lungs and breathing, are there any exercises that you recommend, or any diet, or anything that we should do that will make sure that lungs remain in good capacity? Because when lungs fail, then there's pretty much nothing one can do. Then they are mostly, it's the end of the road for most patients.
Okay, as I said before, step number one is to try to do your best to avoid infection by following hand hygiene.
Okay,
And keeping distance from anyone who has respiratory tract infection
right.
manifestations like coughing or sneezing. On the
Mhm.
other hand, for anyone who is feeling that he took some infection, like feeling runny nose, sore throat, or feeling some fever, there are natural things which can improve immunity,
Okay.
like taking the bee honey,
Steam?
like
Steam maybe?
yeah,
Take
steam can
is
help.
good?
No, steam can help to open the nose.
Okay.
Okay, but to improve immunity, I think that honey is good for most of patients. It will improve immunity, but in the end, if the patient is feeling sick and there is no improvement within 24 hours, the patient has to meet the doctor.
Okay. All right. And finally, I wanted to ask, because these are the questions we routinely get. What about the inhalers and the vapor rubs and those kind of things that people use, especially, when they rub it on their chest? Whenever there's a problem, we rush to
Yes.
these OTC available treatment options.
Okay, but there is one thing to decide that you have bronchial asthma exacerbation. This is a doctor decision. Okay, the patient who knows already that he's bronchial asthma, most of patients who are having bronchial asthma are having rescue inhalers at home.
Mm-hmm.
And they know that they will take 2 puffs from the inhaler to improve shortness of breath. But for anyone who feels chest tightness or manifestations of asthma for the first time, has to meet the doctor immediately. For manifestations of asthma for the first time, has to meet the doctor
Has to
immediately.
meet the doctor. All right. Thank you so much, doctor. That really helps.
Okay. Thanks.
All right.
Thanks for your
All right.
call.
The smooth music and live talk with Ronak Kotecha. This is Talk 100.9.